What is the priority nursing intervention for a client experiencing a hypertensive crisis with signs of organ damage? A. Administering antihypertensive medication. B. Placing the client in a semi-Fowler's position. C. Providing emotional support. D. Monitoring vital signs every 4 hours. The correct answer is A. Administering antihypertensive medication. Rationale: administering antihypertensive medication promptly is crucial in hypertensive crises to prevent further organ damage. Which of the following findings should the nurse prioritize when assessing a client with suspected sepsis? A. Hypotension. B. Bradycardia. C. Hyperglycemia. D. Increased urine output. The correct answer is A. Hypotension. Rationale: hypotension is a hallmark sign of septic shock, indicating inadequate tissue perfusion and the need for immediate intervention. What is the priority nursing intervention for a client with a suspected overdose of opioids? A. Administering activated charcoal. B. Administering naloxone. C. Providing emotional support. D. Encouraging the client to drink fluids. The correct answer is B. Administering naloxone. Rationale: naloxone is an opioid antagonist used to reverse the effects of opioid overdose and restore respiratory function. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of type 1 diabetes mellitus? A. Administering oral antidiabetic medication. B. Encouraging weight loss. C. Teaching the client how to administer insulin injections. D. Encouraging a high-carbohydrate diet. The correct answer is C. Teaching the client how to administer insulin injections. Rationale: insulin administration is a cornerstone of management for type 1 diabetes mellitus and requires client education for self-care. What is the priority nursing intervention for a client with a suspected opioid overdose who is unresponsive with shallow respirations? A. Administering naloxone. B. Placing the client in a supine position. C. Administering oxygen therapy. D. Administering intravenous fluids. The correct answer is A. Administering naloxone. Rationale: naloxone is indicated for reversing opioid overdose and restoring respiratory function in clients with opioid-induced respiratory depression. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of multiple sclerosis, MS? A. Encouraging frequent rest periods. B. Administering intravenous antibiotics. C. Providing a high-sodium diet. D. Administering corticosteroids. The correct answer is A. Encouraging frequent rest periods. Rationale: fatigue is a common symptom of MS, and encouraging rest periods can help manage fatigue and conserve energy. What is the priority nursing intervention for a client with a suspected overdose of tricyclic antidepressants? A. Administering activated charcoal. B. Administering a beta blocker. C. Providing emotional support. D. Administering flumazenol. The correct answer is A. Administering activated charcoal. Rationale: activated charcoal helps absorb toxins and can reduce absorption of tricyclic antidepressants in cases of overdose. Which of the following findings should the nurse prioritize when assessing a client with a suspected hemorrhagic stroke? A. Hypertension. B. Bradycardia. C. Hyperglycemia. D. Altered level of consciousness. The correct answer is D. Altered level of consciousness. Rationale: altered level of consciousness is a critical sign of neurological deterioration in clients with hemorrhagic stroke and requires immediate attention. What is the priority nursing intervention for a client with a new diagnosis of asthma? A. Administering a beta blocker. B. Providing emotional support. C. Administering oxygen therapy. D. Teaching the client how to use an inhaler. The correct answer is D. Teaching the client how to use an inhaler. Rationale: education about inhaler use and asthma management is essential for promoting client self-care and preventing exacerbations. Which of the following interventions should the nurse prioritize for a client with a new diagnosis of chronic obstructive pulmonary disease, COPD? A. Encouraging smoking cessation. B. Administering bronchodilators. C. Administering intravenous antibiotics. D. Encouraging a high-sodium diet. The correct answer is A. Encouraging smoking cessation. Rationale: smoking cessation is crucial in managing COPD and preventing further lung damage.